Hi, this is Malcolm Wright from EQUICARE Health. In this webinar, I'm going to review how EQUICARE can support organizations that have multiple facilities. EQUICARE has always been able to meet the needs of standalone cancer centers. With our latest release, the system can also meet the needs of large, multi-facility organizations. There's a number of benefits to running a single system across the enterprise, including lower costs for hardware, software, and system administration, flexibility to manage patients and processes spanning multiple facilities, consistent practices across the organization, and reporting on data spanning multiple facilities. EQUICARE allows customers to define one, two, or multiple facilities within their system. Typically, you'd set up one facility for each treatment center within your organization. Each facility can be individually managed to reflect its unique branding, web content, legal statements, patient communication, and staffing. For example, in this screen, it allows you to manage things like contact info, time zones, and URLs for your portals for that specific facility for Salt Spring Radiation Oncology. And with this screen, you can manage the facility's Contact Us form that's presented to patients in the patient portal. So you can ensure that what the patient is seeing when they log into Salt Spring Radiation Oncology is specifically targeted for that facility. Since facilities may be located in different legal jurisdictions, you can also define different legal language, like terms of use for each facility. Here's an example. And since facilities may share many of the same settings, it's easy to copy settings from one facility to another using our copy capability. In a multi-facility organization, the patient's experience of EQUICARE is based on the facility where they're being treated. So when a patient logs into the portal, the branding and the color scheme that they experience is based on that facility. And the content of many of the web pages on the portal is also facility specific. So for example, when I look at our Contact Us page, this is what I see for Saturna Cancer Center, and this is what I see for another cancer center. Same version of EQUICARE, different facility. Also, the communications they receive from EQUICARE is based on their facility. It includes the branding from their facility as well as any content that's facility specific. That's things like the printed information in their care plan. The same applies for emails or text messages sent to the patient from EQUICARE. The aim is to ensure that each facility can control what the patient experiences and ensure that it meets their specific communication goals. In a multi-facility organization, the care provider's experience is defined based on the facilities where they work. Each care provider can be granted access to one or multiple facilities, and this controls the information that's available to them in EQUICARE. So I can filter based on one facility, all facilities, or a specific facility. The same is true for our analytics and reporting module, where a care provider who's authorized to run reports can only report on activity at the facilities where they work. For users with reporting authorization at more than one facility, they can choose to report on one facility or multiple facilities in a single report. So here's an example of reports for Saturna Hospital only or for Saturna, Salt Spring, and a third hospital. To ensure HIPAA compliance, the care provider's access to patient records can also be strictly controlled. So access may be limited to the patients that they manage directly, or it can be extended to all patients at the facilities where they work, down here. Since EQUICARE users must be able to complete workflows quickly, we've taken steps to ensure that the lists presented in the system remain short and targeted to a specific location. Like this example where I want to add care team members. The default list of providers here only includes those members who are flagged as a favorite at the patient's facility. The goal of all this is to ensure that care providers can access the patient records and system information that they need to do their job, but limits them based on their scope of work. Since organizations may have facilities spanning 2 or more time zones, and since EQUICARE may be integrated with EMR systems in different time zones, the system was designed to ensure that all communication about dates and time zones is time zone aware. So when patients review information about their scheduled appointments, for example, or when they receive a reminder about an appointment, we highlight for them if the activity occurs in a time zone that's different from their home facility. These are just a few of the examples of how EQUICARE supports organizations with multiple facilities. If you want more information, please visit our website or send us an email. Also, feel free to watch the other webinars in this series, also available from this website.